Hi, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Kerry Reller. In the first part of the conversation with Dr. Ryan Budwany, we talked about what's broken in pain care, why so many patients feel stuck, and how delays in treatment can lead to worsening outcomes. In this second part, we shift our focus to solutions. We'll dive into what modern pain management can actually look like, minimally invasive procedures, regenerative medicine, and how innovations like artificial intelligence are helping patients get faster access to care and better results. If you're looking for hope, options, and a better path forward, this is part of the conversation for you. All right, here we go. Okay, you were going to tell us about the pain management of migraines from your perspective.
Yeah, migraines is a very common problem that a lot of our patients have. And when they're coming to us, they're coming a little late because they tried all these medications work, but they have so many side effects, right? So they have the drowsiness happens, the cloudiness or brain fog that results of these medications and really affects our patients. Because if you have a migraine, you're out for the day essentially. It blocks off several days of your time when you deal with this, especially even if you're on medications. And so what we can do is we can actually use injections to target the occipital nerve, which are some of the nerves that are triggering these migraines, and turn that signal off. And so, again, we can do injections for that. We can do ablations for that. And in fact, we can even do those implantable therapies, the electroceutical approach, by putting those hair thin wires next to those nerves to turn that pain signal off. And it works exceptionally well in those situations. Another set of patients that do extremely well with this are patients that have trigeminal neuralgia. A lot of these patients, they're really living in a very difficult space because either you take medications that sedate you or you need large, painful surgery that often does not fully get you back to your function. And so what I would encourage patients to take is try the injection-based approach for that because it seems to work extremely well. Our patients do really well with this. And again, it's done to the head of a needle, so it doesn't really require a lot of change on the patient's part. And again, it's secondary to misfiring in that area, the nerve miss.
The nerve misfiring.
So we try our best to control this with the injections. That is correct.
I can already think of a patient who I have not considered, who has really bad migraines, and I've not considered to send to pain management before, that could really benefit from something like this, like an alternative approach. That's good.
Absolutely. Yeah, we would be happy to work with
Mhm.
them on that.
So I think basically another big proponent of your practice and everything that you're doing is AI. And it's a big buzzword right now, right? So, if from your perspective, how should patients really be thinking about it? And how are you using AI in your practice today?
So I think it's a wonderful question. It's something I'm extremely passionate about. And my practice, we utilize advanced technology from day one. Before we delve into that, let me explain what artificial intelligence is because it's such a buzzword. We hear about
Mhm.
this all the time. And basically, from the patient's perspective or the clinician's perspective, right, it's just another tool in our toolbox. It's not there meant to really replace your physician or your clinician or a therapy model. It's there to really assist you. And what it allows us to do is allows us to crunch all the information that's out there all at the same time and then provide you better support in whatever therapy you're undergoing. So let me give this to you in another example, right? Imagine if you have a lifetime of patient records. You've undergone thousands of different imagings and different either procedures or injections or physical therapy and chiropractic sessions. You're on multiple different medications for things, right? That's a lot of information. Even if we had our in-office staff put all that information, all those EKGs and X-rays together, it would take them years to organize that for one individual patient. Now imagine if you were seeing hundreds of patients in a month, it's an impossible task. So what artificial intelligence does is it combines all this information very quickly, right, in a matter of minutes or seconds, and organizes this in a relevant form so that you can actually understand it as a physician and as a clinician and communicate this to your patients. And so this is very important because it helps you. Basically, AI goes in and red flags things based on the patterns it recognizes. So now I'm going to sound a little geeky and nerdy, and I'll explain to you how it recognizes these patterns. Okay. It recognizes these patterns with something called a large language model. Essentially, this is trillions of data points that have been put into that AI software to recognize key buzzwords like high cholesterol or back pain or neuropathy or migraine, all of those different things. I'm trying to make it very simple, but again, it recognizes all relationships associated with those kind of things and what the key red flags are, so that when you put that information in, that AI software easily red flag it for you and then help us to guide whatever diagnostic outcomes we're looking for, or what type of next steps we're looking for in your treatment algorithm. So I don't know if that confuses people and makes things a little bit more clear, but it's not something to be afraid of. I think artificial intelligence, much like the internet, is another tool that's helping us to improve care. And one of the things that it's doing in my practice is I'm using the physician avatar. So do you know what I'm talking about there, Kerry? Are you familiar with this?
I know what avatars are, assuming that's what you're going to go into, but no, people listening may not. So please elaborate. What does that mean?
About 4 years ago, we started working with a company called OnDoc AI, and we developed. So I became the first physician avatar that I'm aware of. Nobody was really utilizing this technology back then, and the reason we developed this technology is because what we realized is one of the barriers for patients to get care was just access to quality information, and then them getting consistently educated on what needs to happen. And so what we found is that I use my avatar, which is my digital twin or my AI agent that looks like me, that sounds like me, but it's actually responsible for educating my patients. So I educate my patients, but when I leave the room, my avatar continues that conversation. Or even before I enter the room, my avatars work with my patient to do the intake, and then using all the information that we've actually fed into the system, and say they're coming in for sacroiliac joint pain or headaches or spinal stenosis, it's educating them on that pertinent information before they even step in to the office. And so I'll tell you why this is so important, right? How many times have you had patients come in and they say, okay, Dr. Geller, you've done a great job. I really appreciate what you're telling me. My spouse is not here, or can you tell me this information again? Now my avatar, my agent, right? This educational video can go home with the patient and they can share that with their loved ones, so then they can make a more appropriate shared decision on what's the next sensible step in the therapy pathway. And so that's what it's allowed us to do. That's one way we're solving this problem, is making sure that our patients have the most up-to-date information. And also it's preventing the delay of information in some of these situations. And for example, if a patient comes in and we're going back and forth and having that conversation on what really needs to happen, it can be quite overwhelming because they're hearing terms they've never heard before. And so, again, that education that we put in using your physician avatar or your digital twin helps to get them several aspects of that therapy, right? So even before they come into the video, there's like a meet your physician video. Before they come into your practice, there's a meet your physician video where they know what the expectations of your practice are, what they're going to see on a day-to-day basis. And that helps to reduce some of the challenges or reduce some of the anxiety alongside that visit. So we found that to be extremely helpful, especially in a field like interventional pain and spine, because there's so many different procedures we do, right? We treat pain from head to toe. So everything from headaches all the way down to ankle pain and toe pain and those kind of things. And so with all these different things, it can be quite challenging and confusing for our patients. And so having an assistant like that educates our patients has been truly a game changer in the way we practice. And the value of having an AI agent like this is, again, I only speak English, but many of my patients speak Spanish or a different language. My avatar can speak every language, right? And provide information in that platform to them.
That's pretty awesome. So you're saying it's a video?
So it is, yes, if you actually go to, again, the website painhealth.com, a lot of all the education videos that are on there, we have a YouTube channel with a lot of those videos on there as well. All those videos are actually created by my digital avatar. So it's my avatar that's actually educating patients and providing them that information. And the value in this, more than anything else, is say if there's a change in an FDA indication, right? There's something that new happens. You don't have to go back in and redo a video. Your avatar is constantly updated, right? Those large language models are instantaneously updated. So every time you're accessing that kind of education, it's always up to date.
Would you liken it to a custom GPT or something that you have fed everything that your methods and procedures into it?
So yes, part of it, yeah. So part of it is this way, but it's also backed by like our national societies. I was talking to you the national society, different meetings we go to, right? Everything is done based on their factual FDA clear guidelines that we're following. And so it's not an opinion that those videos have, it's just facts. The goal of it is to communicate facts, right? So that our patients have that. And we wanted to make it consistent so that whether I am here in Florida or I see patients, again, across 27 states in the country and beyond, all that information is always consistent.
Yeah, I feel like these kind of ways to get the correct information out so they're not just searching social media and things like that and getting weird TikTok videos and misinformation, to have it coming directly from you and the societies that have done evidence-based clinical medicine is an important thing. And then continuing the care outside the room, which I know that's something that you really focus on. It's something I try to focus on too, but part of that is this podcast, right? But also, what else? You were mentioning something called remote therapeutic monitoring. So how does that tie into this AI physician avatar model?
That's a wonderful question. So I think that's an emerging dynamic and a technology in what we do. And from the very beginning of clinical practice, right, the way we manage care and the way we offer advice on the way we see our patients has been confined to the four walls of our clinic. And part of it that has been limited by technology, but it's also been limited by the way we actually think about healthcare. Healthcare and your pathology doesn't just happen to you in the 15 or 20 minutes you're spending with that patient. It's always there. In fact, the way patients are dealing with their pathology is happening majority of the time outside of that clinic setting. And so what remote therapeutic monitoring allows you to do is utilize this technology with the guidance and support of the physician avatar and AI to actually provide you care outside of the clinic in addition to what you're experiencing while you're with that physician. And so I'll give you an example, right? If, say, a patient comes in for low back pain, and in fact, last week I had a patient in the very same situation. Traditionally, if that patient came in and we provided them like an injection and said, okay, go see physical therapy, we would have done that and followed up with them in 4 to 6 weeks without any other contact, right? We would have hoped and assumed and prayed that they continue to get better and follow that treatment pathway. Now, with the RTM systems that we're using in-house, the remote therapeutic monitoring systems we're using in-house, each one of our patients, as soon as they get an injection, they are basically accompanied by this system where when they go home, they're either getting text messages or protocols where daily it's checking in on them. Where is their pain score? Did they improve based on that injection we followed? And so a couple of weeks ago, I had a patient that this was actually really important, that we did the injection and the patient had actually come in because they had experienced an injury at work and they were struggling to go back to work, and that's their main livelihood. So they really wanted to get better. And we tried conservative therapy. It didn't work. So we tried the injection, right? The injection started helping the patient. And something happened, like that we saw that on day 2, day 3, day 4, for the first week, the patient was doing great. And then something happened on day 10. And all of a sudden, the RTM system, that technology, the wearable technology they went home with, alerted us that, hey, their pain scores have gone up. And this patient is no longer walking the same amount of distance. But we had not heard nothing directly from our patient. So our MA at our clinic reached out to the patient and said, hey, what's going on here? Has something changed? Because the technology alerted our clinic. We reached out to the patient. And in fact, the patient had new pain, new sacroiliac joint pain, right? Because I guess they had lifted a box incorrectly or done an incorrect maneuver. And as soon as that happened, we paired that patient up with the physical therapist. They got care immediately within 72 hours, and they were back to their baseline within the first week. So again, within instantaneously time, essentially, they were back to their baseline, right? 2 weeks from when they had originally seen us, they experienced an issue. We corrected the issue because of this technology, and they got back to their baseline. If this was the traditional model, it would have been 6 weeks before we had seen them. So that was really impressive by how quickly this technology is assisting us in getting patients back to their baseline. And it's not just in interventional pain care, right? It's in everything we do, whether it's in primary care or advanced care like cardiology or GI or oncology or beyond. Our patients' healthcare is a part of their day-to-day function and activity in their life. That's where they're there. It's only a snippet of time that we're seeing them in. And I think that this technology is really going to enable us to change the way we actually see healthcare. Let me give you one quick example here, right? Next time you see a patient, right, that's been your patient for a while, you're going to say, oh, this is X, Y, and Z. How have you been doing since I saw you last? And I challenge you that our field in healthcare is completely going to change. We're not going to ask our patients, how have you been doing? In fact, we're going to say, I've been following you along. My AI avatar or my AI agent or this technology has been guiding me every single day. And we see that you're progressively getting better. Your sugars are getting better. Your pain scores are getting better. You're walking more, you're losing weight, whatever, right? You're getting close to your goals. So when the patient comes back to us, we're not going to say, how have you been doing since we saw you last? We're going to be asking them, what else can I do to support you alongside your health journey? That's where the field of medicine is headed. And it's because we're no longer going to be treating the patient in snippets of time. We're always going to be involved in that care pathway. And it's because these technologies like physician avatars, AI agents, and artificial intelligence are able to crunch all these trillions of data points in real instantaneous time to make sure that we're always enabled and engaged with the patient's best outcomes.
I feel like that's on its path to the personalized medicine approach too. So these are technology that can only help us get there even faster, right? Do you have a device on them for your remote therapeutic monitoring that they picked up? Or?
Is, right? You can do it based on wearable technologies, right? Like an Apple Watch, for example, right? They're app-based technologies. But you can also do things and simple things like text-based technology. So if a patient is daily getting a text message to report their pain score or to whatever pathology we're working with to say, hey, have they improved, where they are at? Because in chronic pain, right, in chronic pain management, you are dealing with this issue long term. So you need these seconds. And a simple phone call doesn't give you specific information, right? So if you're dealing with a person with a high heart rhythm or high blood pressure, if you're getting constant monitoring, then you can quickly identify what those triggers might be as well. So that's what makes it very different. And at the same time, it's really changing the way we see medicine. You asked me a question at the very beginning, right? That the way you practice medicine, where do you see it going? Really, my passion, technology is a huge portion of what I do, like the med tech component. I work with many of these device manufacturers. I lecture nationally on med tech, artificial intelligence, those kind of things, and even the development and the guidance of some of these minimally invasive technologies. But really, what the biggest passion of all of this is to prevent the chronicity of pain. So we think of chronic pain management or we think of chronic any condition. And I think the chronicity is there is because we were limited by how we saw the patient in this entire thing, how we saw their treatment plans. And if we're able to treat things sooner, we're able to actually get the patients in before this becomes a long-term issue. Just like that patient we had a couple of weeks ago, if she had that pain and we didn't correct it or we didn't get that notification, it would have become another chronic pain issue for that patient, right? It would have been another issue that have eventually led to some level of debility or disability. And since we flagged it sooner, we were able to identify that sooner. So I do believe in healthcare as a whole. If we are able to actually see these patients sooner, we're able to identify what in their environment, in their day-to-day life is impacting, their condition, then hopefully we can prevent that chronicity of pain. And hopefully the field of chronic pain management doesn't become a chronic pain management issue. It becomes really functional guidance and human performance optimization.
Wouldn't that be amazing? That's awesome. I feel like we can see that in the future for sure. Like maybe no more chronic pain or anything like that. In our office, we use, I think I mentioned this, but remote patient monitoring, which is just a little different. Obviously, I think the remote therapeutic monitoring, the model that you're doing is a little bit more advanced because we're looking at the blood pressure, the weight, and seeing if there's anything like triggering that maybe we need to bring in the patient sooner, whether it's uncontrolled blood pressure or an increase in heart failure, you can see the weight going up or something like that. So those are also some ways, like the whole technology approach of how you can catch patients sooner, faster, hopefully keep them out of the hospital. Obviously, insurance likes that because you are going to be doing less cost to them if you're able to keep them out of the hospital and things like that. So I think these technologies are very important and they need to be included.
That last part, I think it's very important what you mentioned, right? That keeping patients outside of the ER or the hospital. In fact, right, CMS is encouraging this. So across all of healthcare, not only are they creating models for reimbursement, but they're actually encouraging physicians to adopt this kind of technology because essentially for the same reason, right? That since we flagged Ms. Anderson, that patient we talked about 2 weeks sooner or 6 months sooner or whatever, we prevented her from going to the ER. We prevented her from ending up getting care that she may not have needed or that may have really put her in a very different situation. And so by enabling this kind of exchange, being aware of our patients all the time, we're able to identify things before they become a full-blown fire. So when that fire alarm goes off, we're able to address it essentially and hopefully prevent things from getting worse. So I think it's preventing the chronicity of any of these chronic conditions, especially like in pain, because that's the lens by which I look at patients. that if I can utilize this technology, if I can utilize my avatar assistants to better educate my patients on the correct therapy, utilize this to monitor how they're doing with the recommended therapy, then hopefully I can prevent any kind of disability or prevent the chronicity of pain in which they get stuck in this cycle of just getting injections or pills forever. And like I told you in the very beginning, I am like the premier non-opioid based practice in Florida.
Mhm.
We prescribe zero opioids for our patients for long-term management, exactly for that reason, that we want to be able to target the specific cause of that pathology, identify it at its core so we can fix it and get the patient back to their long-term goals.
Yeah, I think that's remarkable. And I'm sure your outcomes for your patients are superior when you get that instant feedback and bring them in sooner if it's required. I think you had said somewhere along there, sooner is better than later, and to get them in immediately and improve their access to care for sure. What kind of patient is the right type for this care?
So are you talking about just for RTM, like remote therapeutic monitoring?
I guess in this case, yes. Yeah.
So I think a lot of these patients, you may feel like you have a technology barrier. That might be hard, but studies show that 98% of people that have cell phones actually have access to text messaging. They respond really well to that. So again, you have HIPAA compliant text messaging platforms that's really
Mhm.
easy to engage and put these things essentially on autopilot, where you have technology on the back end managing some of this, alerting your MAs and your office staff. So that's one part of it. As far as what's the ideal patient for an interventional pain provider or interventional spine provider, so you can have like sports medicine patients where we treat joint pain. That's a part of what we do, right? We provide sports medicine related therapies as well. So it all really depends on your perspective and your goals as a patient. If patients are coming in saying, hey, doc, I have this, but I want to optimize what I can do. I want to get better and get back to my day to day life, right? Whether it's playing with my grandkids, going on walks with my spouse, or simply just preparing a meal or returning to work, all of those folks fit into this category, right? You as a patient have to want the initiative, right? You want to be taking that initiative to get better, because as great as these resources are and as great as the tools are, and I have an amazing staff that's going to help support you every step of the way, the initiative has to come from the patient. If the patient really wants to get better, then we will do everything we can to support you on your pathway to get better.
I think that's so true in every aspect of medicine. I feel like the patient's motivation level and want to get better is very important. I find that there's still a group of patients who just want that band-aid medicine. And they're not the best for me, but probably not the best for you either. And I think that those aren't the right patients maybe for some of these things, right? They just want, I don't know, medicine and healing.
Go back because somebody asked me a very similar question not too long ago. That people just want band-aid medicine or just band-aids to fix the problem temporarily. And I think that's the mindset, unfortunately, they were introduced to, right? Like I can't
Mhm.
imagine if, say, your child or whatever, you fall off your bike, you skid your knee or something, you have band-aids on, okay, essentially. And then, the next week, you're still hurting there, but you just put a band-aid on. Those people were given that mindset because maybe wherever they got access to care did not have these tools available, or those were the only options available at that time. So I would challenge them to reconsider other options that are available in your community. Like Florida is a beautiful state. We have a huge dynamic of patients, right? We have a big platform of retiree patients. We have a lot of healthy young adults. Tampa, especially, medtech is growing significantly. And Tampa
Mhm.
we have a very dynamic population. We have a really active environment where patients are outdoorsy patients. They want to do things in that active environment. And if their single goal is to stay active and functional as long as possible, then we're that kind of practice that can support you. Because again, we have tools that a lot of other folks may not have adopted yet, just because, again, like I said, in Appalachia, where a lot of these technologies developed, because that's the epicenter of where the opioid epidemic crisis started. And as a result of that, we started some of the first opioid free practices up there because we wanted to enable function over masking the pain. And now we have these technologies available in Florida. And so, as far as I'm aware, some of these advanced technologies, especially focusing on treating pelvic pain with electroceutical approaches or headaches, CRPS, peripheral diabetic neuropathy, also things like a lumbar decompression, SI fusion, one of the unique practices that offer this. And we get referrals from not just all over the state, but we have patients coming from all over the country coming down to get this kind of therapy.
Yeah, it's amazing. I think admittedly, the patient who wanted the Band-Aid approach was in that older generation, which I think is what more typical medicine was back then anyway. So I don't see too many patients in the newer generations are wanting that. They're always wanting to get that functional medicine or root cause approach and see things from that, just to throw that out there. But so we talked about so much, and I don't want to miss anything. Is there anything else, like in the AI perspective, the technology perspective, or anything else that you want to share with the listeners?
I think that the patients have to take the initiative, right? There's a lot of great providers in the community, and keep an eye on the technology, right? What are your goals? If your goal is for functional improvement, right? Like you talked about that, it's a lifestyle perspective now, right? We're going into lifestyle medicine and all of these other things, right? A lot of these technologies we talked about today, all of these technologies, in fact, are actually covered by insurance and different payers, right, including Medicare. So this is something to keep in mind that everything we talked about is covered there. One of the things that we didn't address, something that's really near and dear to my heart, and I think that's going to be a bigger part of how we practice in interventional spine and pain care, is talking about things like orthobiologics. So what that means are things like the terms like platelet-rich plasma or PRP therapy, or things like stem cells, peptides. Those kind of things are actually just at the forefront. I mean, we're just literally scraping the surface of these incredible technologies like exosomes that are just coming down the pipeline. And again, we offer a lot of these therapies within our own practice as well. The value of this is, again, that we're trying to restore some of these things, right? So it's restorative therapy rather than aggressive therapy that it's too late to capture. And so the value in looking at this is see where you fit in, right? See where you are in terms of your own pathology, what your goals are. And again, we would consider every patient that wants to work alongside us to get better. Because my end goal for my patients is I want you to get better so you can go on to the next goals in your life. I don't want a patient who's going to come in forever and be a chronic patient where I can't help you. Because if I can't help you, then I'm failing you and I'm failing myself. My goals for all my patients is that I want to work alongside you to get you better as quickly and as safely as possible with the tools we have so that you have long time goals that you can achieve.
I think that's great advice. And I think you're right. The patient needs to play a large role in everything as well. I guess I probably don't have time for all the biologics, things like that. But what would you say is one thing a patient with pain can start doing today to start feeling better?
So I think work really closely with those primary care doctors that you're part of, right? I can't overemphasize how important nutrition is, right? How important exercise is, how important mental health is, right? Practice of interventional pain or any of these chronic conditions you deal with, it's dynamic, right? It's not just one approach. You need to work on all these other elements of it because it ties into your own personal betterment. So as great as these technologies are, if I was to implant one of these technologies, right, those other things also have to fall into balance. So again, being physically active, right, enjoying the beautiful environment that we're blessed to be in, part of the Tampa Bay area and all of Florida, right? Go and take walks at Disney, go to all these parks, spend time outdoors, eat well, and then figure out what are my goals. And we'll do our best to help you guys out.
You've mentioned the beautiful environment that we live in Tampa several times. What is your favorite outdoor place in our area?
So there are several, right? We really enjoy going to the beach. Obviously, you're in Clearwater, so we have some of the best beaches in the world, in my opinion, there, or even down as far as Siesta Key in Sarasota, which I think is almost heaven on earth. And then again, we have a lot of other parks, right? We're really close by to Disney and Universal. And so those are other ways to just engage in the outdoors, right? And again, there's no better place, in my opinion, that we could be in. I'm just grateful that we can offer such amazing technologies and medical solutions to our patients.
Me too. So if people want to work with you or find you, where can they do that?
The easiest way, just go to the website, www.painhealth.com, or they can always reach my office at 813-726-PAIN. That would be the easiest way to do that. But we're here to help you guys out as much as possible, and we'll do everything we can to support you.
And obviously, you mentioned going to your website and looking at all the educational videos. So I think that could be helpful for them as well, right?
Absolutely. Yeah. There you can start researching things. There's a lot of information on there. So every type of technology we offer, there's an innovations tab there. And so all the latest innovative technologies that are out there that we talked about, we didn't get a chance to cover everything else there, but there's a lot of information that's available. And reach out to us if you want to email us directly. The email address is the word better at painhealth.com, and we'll do whatever we can to assist you.
Awesome. We'll put all that information in the show notes. And if there's anything on there that we didn't talk about that you want to come back and talk about another time, we're happy to have you back for sure. Thank you, Dr. Budwany, for joining me today on the podcast. And everybody stay tuned for next week's episode.
All right. See you guys soon. Take care.
Bye.